Did you know that 70% of people believe that high cholesterol is the only risk for heart disease, according to the AHA? Or that 50% of heart attack patients have normal cholesterol levels, according to Harvard. And many people think that cholesterol is the only indicating factor, and it's not. If you're new to my channel, my name is Dr. Erica Steele. I'm a board certified naturopathic doctor. I hold 7 degrees in my field, all in the natural healthcare space. I like to say that I went to school so you don't have to. All this month, we're talking about hypertension. And so if you are interested in learning more about holistic strategies to help you either prevent, stabilize, or help support, heal your body from hypertension, go ahead and click the link below. There's a free webinar just for you. So in this video, we're going to talk about myths, right? Because there's a lot of myths and misconceptions when it comes to heart disease, when it comes to heart health, when it comes to hypertension in general. So one of the myths that we often see is that only old people get heart disease. And unfortunately, that could not be further from the truth. Young people more and more and more are increasingly at risk, a lot of times because of lack of diet, lack of exercise, not drinking water, really getting into high stress, lifestyle patterns and not taking care of yourself. And so as a response, younger people, unfortunately, are also developing heart disease. So age is not even, it's one factor, but definitely not the entire picture. The next myth is if you feel fine, your heart is fine. This one drives me, I think, the most nuts because we cannot base our health off of symptoms. Symptoms are not indicating factor. And with heart disease and heart risk, unfortunately, the symptom is the heart attack. So we definitely can't base it off of symptoms. We need to base it off of data, and we need to track and monitor and really take care of these factors that affect our heart and our heart disease. So high blood pressure and plaque buildup tend to happen silently based off of your lifestyle factors, eating constant sugar, not working out, not drinking enough water, not getting enough fiber, eating lots of processed foods. All of those things play in, unfortunately, to your body breaking down. And so lastly, the last myth I'll go over is all about fatty foods. So a lot of times people focus, oh, I don't eat fried food, so that's fine. Well, actually, a lot of processed carbs that send your blood sugar all through those spikes are often worse than healthier fats. Puts a lot more pressure on your metabolic system. And so not to mention the fact that a lot of that stuff is enriched. It's got flour, wheat, all sorts of chemicals in it. Oftentimes it's not even really good food, but we get so addicted to the food that we're constantly eating it, creating this cycle and these patterns and these habits. So if you want to break free, I'm happy to help you. There's tons of free content on my YouTube channel as well as in our communities. All this month, we're talking about hypertension. So click the link below if you want to learn more about holistic hypertension strategies, and like, share, comment, subscribe, and ask any questions below.